this? If so, you've come to the right place. Dr. Perkins is here to help you with tips and explanations that will not just help you learn the information, but master it for years to come. Alright guys, today we're going to be talking about bone cells. So the osteoblast, the osteoclast, and the osteocytes. So we have the osteoclast, they tear down the bone. The osteoblast, they build up the bone. And the osteocyte is basically telling the clasts and the blasts what to do. So why do we need cells to build up the bone if we have cells that are tearing down the bone? Sounds a little goofy to a lot of students. So it sounds like some government program's gone horribly wrong. Over here we're printing off money as quickly as we can to increase the money supply. Over here we're burning money as quickly as we can to increase the money supply. Here, it doesn't make sense. Why would we run both of these programs at full bore, right? Either we got too much money and so we should stop printing it off and burn it, or we got too little, we need to stop burning it and continue to print it off, but we shouldn't be running both at full blast. Well, you're exactly right. Just like the money supply, we're not going to be using our osteoblasts and clasts full bore at the same time in most cases. So, kind of give you an illustration as to what's going on. Imagine you're driving and your roads look like this. What do you want them to do? You want them to pave the road, right? Well, before your roads can look like this, right? We have to do this first. So what this is going to do is it's going to strip the road. It's going to mill. And so we're going to remove all this broken down road, all this road with lots and lots of cracks in it that aren't going to be able to hold anything. Now that we've removed all that broken down road, we can go to the next phase, which is this, right? We're going to put asphalt down, brand new road. Well, the same thing's happening in your bone. Right? If I have a bone that looks like this, right, with a bunch of cracks in it, that's not going to be so good. So I'm going to destroy this bone right here, and I'm going to replace it with brand new bone. And so my bones are going to be nice and strong, just like that road. Alright? Alright, so why else would you need to take down the bone? Well, in order to answer that, think about what your bone is made up of. So 2/3 of your bone is calcium and phosphate, 1/3 is collagen. Now these have different roles. The collagen kind of makes your bone more flexible. The calcium phosphate make your bone harder. So what's going to happen if you have severe nausea, vomiting, diarrhea, anorexia, right? You're sick as a dog, you got some sort of stomach bug. Well, you're not getting enough calcium and phosphate in your diet, right? And so what's going to happen is we're going to start breaking down the bone and just tearing out this calcium phosphate. Right? And so the reason why we're doing that is because we don't want the calcium and phosphate level in your blood to drop to a dangerous level that's going to kill you. Right? Now, this comes at the price of tearing down our bones. So what's the big deal about tearing our bones down? Well, if we break our bones down too much, they're going to be too weak and we're going to snap like a twig. Well, I don't want my bones snapping like a twig. So when I get over that bug, right, I'm able to eat again, I'm able to drink stuff again, life is pretty good. Well, what's going to happen is that extra calcium and phosphate is going to go from the gut into the bloodstream. And from there, we're going to use it to build up the bone. Another factor that's going to be taken into consideration is how much you use the bone, right? So you're Mr. or Mrs. Couch Potato, you don't really need that strong of bones, right? Bones are heavy. If you're 5'4", you weigh 120 pounds, you got 24 pounds of bone that you gotta haul around. Right? I don't want to haul around more bone than I need to, right? And so if you're not doing anything, this bone is gonna get weaker, weaker, weaker. Now, if on the other hand, you're lifting heavy stuff at the gym, your bones need to be a lot tougher. And so that constant exercise is gonna stimulate your osteoblast to get tougher. Alright, so here are some NCLEX style questions. Your patient has a very aggressive form of osteoclastoma. What labs do you think will be important to monitor? Select all that apply. So are we going to monitor the calcium, the phosphate, the pulse ox, the potassium, or the lithium level? All right, so once again, osteoclastoma, what lab should we monitor? Give yourself a second to kind of think about it, and then I'll give you the answer. Alright, so the answer is going to be calcium and phosphate, right? So once again, what is an osteoclast do? Well, it tears down the bone, right? An oma just means it's a tumor, so it's the tumor of the osteoclast. And so I'm just tearing down the bone left and right, right? What's going to happen is that calcium and phosphate from the bone is going to go into the blood. And so my calcium phosphate level in the blood can go very high. And we're going to want to monitor that to figure out where we're at. Alright, next, NCLEX style question. Your patient has a very aggressive form of osteoclastoma. What are some complications that you could expect to see from this disease? Select all that apply. So are we going to be dealing with constipation, diarrhea, kidney stones, pathologic fractures, and or confusion, right? So how many of these or if any of these things do you think we're going to be dealing with? Alright, give yourself a second to kind of think about it, figure it out. And when you're ready, let me know. Okay, so the answer is every single one of these except for diarrhea, right? So what's going to happen? The high calcium is going to affect your intestines, and so they're not going to move like they should, and so you're going to get constipation. Now your kidneys are going to realize, whoa, okay, time out here, we got too much calcium, pee it out, pee it out, pee it out. And so you got very high levels of calcium in the pee. Well, what happens if I got too much calcium and not enough pee, not enough water in the pee? Well, this is where I form kidney stones. Alright, well, what's happening? Well, this tumor is sucking the calcium out of my bone, right? Draining that bone of all the calcium. And so my bone is going to get very weak wherever that tumor happens to be, and so it can start snapping like a twig. Not good here. Alright, the other thing is the high calcium levels can affect muscles, so aka, right, the smooth muscles and your digestive system. It's going to affect your heart. It's going to affect your skeletal muscles, so it can affect all those things, right? And it can also affect the brain, and so confusion is going to be a very common side effect here. And so you can kind of use this to get a jump start on things, right? You got your patient with the osteoclastoma, and all of a sudden he's getting confused and so on. Okay, hey, it might be that he's going downhill. We need to check a calcium level right there, right? Your job as a nurse is to advocate for your patient. And if you don't know what's wrong with your patient, it's pretty hard to advocate. All right, guys, good luck, and I hope this helps.